condemning the kidnapping and killing of all 4 teenagers, Israeli and Palestinian.
That's right. Well, when choosing a doctor, Dell, do you first look at his or her years of experience, or do you look at the doctor's race?
There are actually a number of studies out that suggest that a doctor's race is now a major factor for patients. John Henry Smith has been digging into the numbers behind some of those studies. He joins us now. Good morning, John.
Good morning, Dell. On that question of whether or not patients are choosing their doctors based on race, let's look at what some of the academic studies say. Johns Hopkins performed the most comprehensive study back in 2002. It indicated that, number 1, patients would choose doctors of their own race when given a choice, and number 2, that patients reported higher satisfaction when treated by same-race physicians. Now, these findings held across multiple racial groups, including whites, blacks, Asians, and Hispanics. So, if this is happening, the next question is why? Much of the study evidence available seems to answer that question from the perspective of black people. A 2012 UCLA Law Review study found blacks nearly twice as likely as whites to report being treated with disrespect by a doctor of a different race. A 1999 study in the New England Journal of Medicine indicated something worse than disrespect. The study found that white men presenting chest pain received better care than women and blacks with the same symptoms. In 2012, Medical News Today found that 2/3 of doctors spent less time and did less listening to black patients during office visits, and the results of those studies could very well have led to this. A 2010 study published in the Journal of the National Medical Association said black patients are more likely to receive better care from black doctors than from white doctors. Now, while we wouldn't want to pass the results of these studies off as a complete affirmation that race-based doctor selection is widespread, at the very least, they would seem to indicate a where there's smoke, there's fire type of scenario. Dell?
John Henry Smith, thank you very much. We want to delve deeper into this right now with Lisa Ruchti. She is a sociologist and author of the book, The Catheters, Slurs, and Pickup Lines. She joins us from Philadelphia this morning. And Ms. Ruchti, you studied in the situation in Phoenix. You also found that race was a factor there in how doctors and nurses were treated and selected. Why?
Well, thanks, Dal. I mean, I should be clear that my study focused primarily on nurses, not on doctors. And I looked at the interactions between nurses and their patients. And what I would argue is that while on one hand we talk about care or nursing care, if a nurse is caring as a personality characteristic, as some nurses just either have or don't have, I'm arguing that this is a social interaction that's often loaded with racial biases or gender or other social identities.
Did the nurses give you any examples of how they had been treated that would specifically point out what we're talking about?
Oh, absolutely. I have so many. And I should mention, too, that the study was conducted over 8 months, 800 hours in a hospital. So it was a long-term study where I found these patterns. So one of the patterns that I found is that nurses of color, including Latina, African American, and Asian American women, were often symbolically demoted or just not recognized as the nurse, and instead were maybe treated as an aide or as a housekeeper. Another example would be, imagine many nurses reported to me incidents of harassment or sexual harassment. It's one thing to negotiate sexual interactions. It's another thing when those interactions include racial slurs. So you can imagine a nurse walking in to a patient room. He is masturbating, continues to masturbate, persists in that, and then proceeds to call her a dirty foreigner. Or another nurse who is clearly speaking English and talking about inserting his IV, and the patient says, I want an American nurse, I want an English-speaking nurse. So many stories are in the book and many stories to tell, which led me to these conclusions that race absolutely informs the interaction of care.
There are clearly then indications that the nurses feel that this is a problem. Most people, though, go to the hospital because they want to get better. What concerns should patients have?
I'm not sure I understand the question. What do you mean, what concerns should patients have?
In other words, is there an indication that because of the way that the nurses are being treated, that is then leading to worse care for patients?
Oh, great question. Absolutely not. In fact, what I observed and what I argue is that nurses of color are doing extra labor in order to tolerate these interactions in order to ensure care. So the larger argument of the book is that this kind of socially loaded interactions are a part of care. And much of the work that nurses do is invisible labor. I'm saying that some of this labor is tolerating and sort of letting go of these interactions so that the patient can receive quality health care. So in fact, it was interesting to talk to the nurses about their experiences. There were so many experiences, but they always talked about how they kind of, just sort of took it in, if that makes any sense.
It does. Lisa Ruchti,
Yeah.
sociologist and author of Catheter, Slurs, and Pickup Lines. She joins us from Philadelphia. Ms. Ruchti, thank you very much for being with us.
Well, it's time now for another look at your 4th of July forecast with our meteorologist, Dave Warren. Dave,